Hi, I'm Katie.
I'm Sarah.
And I'm Monica.
Today we're going to be talking about inguinal and sports hernias. The objectives of our presentation are to define the difference between inguinal and sports hernias, discuss the structural anatomy of each type of hernia, and to identify the risks of injury.
So first we will define what an inguinal hernia is. An inguinal hernia occurs when tissue, such as part of the intestine, protrudes through a weak spot in the abdominal muscles. This can be painful, especially when you cough, bend over, or lift a heavy object. Inguinal hernias are up to 10 times more common in men than in women. About 1 in 4 men develop a hernia at some point in their life. Treatment for this is surgery to fix the inguinal hernia that is painful or enlarging. So we will now talk about the structures that are a part of an inguinal hernia. The main parts are the inguinal triangle, the inguinal ligament, and the inguinal canal. So these are two pictures of the inguinal triangle. The triangle is located within the inferior medial aspect of the abdominal wall. It has the following boundaries. The medial wall is made up of the lateral border of the rectus abdominis muscles. The lateral wall is the inferior epigastric vessels, and the inferior wall has the inguinal ligament. Weakness in the inguinal triangle may cause an inguinal hernia. The inguinal ligament is the floor of the inguinal canal. It is formed by the external oblique aponeurosis as it folds over and inserts at the anterior superior iliac spine down to the pubic tubercle. It separates the abdominal cavity from the lower leg. So the inguinal ligament is not a big part of an inguinal hernia, but it's important to be known that it provides a strong support to the inguinal canal to help inhibit a herniation.
We will now show you where the inguinal canal is on the actual skeleton here. So we have a picture here just to kind of demonstrate where it is on the body. So the inguinal canal serves as a pathway by which structures can pass from the abdominal wall near the groin to the external genitalia. So this right here is the inguinal canal, the green one right here. So potential weakness in the abdominal wall may lead to herniation. The inguinal canal is bordered by 4 walls, so 1, 2, 3, 4. It has 2 openings, the superficial and deep rings. So the anterior wall, which is located right in this region here, is where there's the aponeurosis of the external oblique, and it is reinforced by the internal oblique muscle laterally. The posterior wall, so it's in this region here, is the transversalis fascia. The roof, so this part here, is bordered by the transversalis fascia, the internal oblique, and the transversus abdominis. And the floor, which is here, is where the inguinal ligament is, which is a rolled up portion of the external oblique aponeurosis, which is also thickened medially by the lacunar ligament.
There are different types of inguinal hernias. The first two is an indirect inguinal hernia. This occurs when the internal opening of the inguinal canal, which usually closes around the time of birth, remains open. This allows a portion of the intestine to slip through the inguinal canal. These hernias are often diagnosed within the first year of life, but may not show up until adulthood. This condition affects between 1 and 5% of normal newborns and up to 10% of premature infants. The next is a direct inguinal hernia. This occurs when a portion of the intestine protrudes through a weakness in the abdominal muscles along the walls of the inguinal canal. These are common in adults but rarely occur in children. The last 2 types of inguinal hernias. The first is incarcerated inguinal hernia, and this happens when the tissue becomes stuck in the groin and isn't reducible. This means it can't be pushed back into place. And the next step of that is the strangulated hernia, when the incarcerated hernia has its blood flow cut off. And this can be very life-threatening and require a medical emergency.
We will now discuss the signs and symptoms of an inguinal hernia. The first sign would be a bulge in the area on either side of your pubic bone, which becomes more obvious when you're upright, especially if you cough or strain. There may also be a burning or aching sensation or pain or discomfort in your groin. There may also be more of a heavy or dragging sensation or weakness or pressure in your groin. Finally, there might be pain or swelling around the testicles when the protruding intestine descends into the scrotum. We have a bunch of pictures here just to demonstrate where exactly the inguinal hernia may be and where you might see the bulge. So there are gender differences in inguinal hernias in men versus women. So inguinal hernias are much more common in men. Men naturally have a small hole in the groin muscles so that blood vessels and the spermatic cord can pass to the testicles. So this is why it may be more common for them to be getting those inguinal hernias. In women, the inguinal canal carries a ligament that helps hold the uterus in place, and hernias sometimes occur where connective tissue from the uterus attaches to tissue surrounding the pubic bone. Femoral and umbilical hernias are more common in women due to accommodating for childbearing. Some inguinal hernias occur at birth when the abdominal lining doesn't close properly. However, for other people, the injury occurs because of weakened muscles from aging, strenuous physical activity, or intense coughing from smoking. Other risk factors include increased pressure within the abdomen, strenuous physical activity, pregnancy, since being pregnant can weaken the abdominal muscles, having a family history of inguinal hernias, or if somebody has chronic constipation, it may lead to straining during bowel movements or urination, which could also increase their likelihood of having an inguinal hernia.
Oh, ow!
What's going on, Katie?
I'm having a lot of pain in my lower groin.
Oh, well, what happened?
Well, I was playing basketball and I was doing a lot of twisting. Ow! It hurts when I twist.
Oh, you might have a sports hernia. A doctor would need to do an exam to check out your injury. Does it hurt now that you're not moving?
No, but whenever I try to twist, it really hurts.
Oh, well, when people usually get sports hernias, after rest it's okay, but the pain can continue during the activity. Do you feel a bulge on your groin area?
No.
Oh, well, it could be difficult to diagnose a sports hernia, so we would have to do an x-ray to check out what you got going on.
I thought that only men or professional athletes got sports hernias.
Well, you're right that those people usually get sports hernias at a high level of sports, but it's also possible that that's what you have. You would have to have some rest in order to heal.
I want to go home and go take a nap.
Lastly, we're going to be talking about sports hernias. This can often be called an athletic pubalgia, especially in the medical community. Unlike an inguinal hernia, where the intestines can protrude through weak parts of the abdominal tissue, this is where a strain or tear of any soft tissue in the lower abdomen or groin area. This often occurs in sports like hockey, basketball, and wrestling, where there are sharp movements that require twisting of the trunk. This can often lead to an inguinal hernia, though it is not always common. As I've mentioned before, a sports hernia occurs when soft tissue of the lower abdomen and groin are stretched. Most commonly, this happens when the oblique muscles to the pubic bone are stretched or torn. Sometimes the tendons that attach to the thigh muscles to the pubic bone can also be affected. This picture illustrates where sports hernias occur inside of the blue border. What are some of the symptoms of sports hernias? Unlike inguinal hernias, there's usually no visible bulge. There might be severe pain at the time of the injury, though rest it may get better, but sometimes it continues during the activity. There's usually pain on only one side of the abdomen rather than both sides, but pain can sometimes come back with movements that require deep abdominal muscles, such as stomach crunches and coughing. You may also see tenderness or bruising in the lower abdomen or upper thigh. And sometimes with sports hernias, pain can go from intermittent to constant.
Thanks for listening!